Hi, and welcome. Thank you for joining us today on Wellness Now. My name is Staci Loalbo, and I'll be your host today. I'm an RN, and I'm the Director of Wellness here at SWBC. It's February, and so it's time to start talking about matters of the heart. So today we're going to dive into the topic of heart disease. Heart disease takes on many forms, and for some, it is a challenge for people from the very beginning of their life. And today we have Amy House. She's with the American Heart Association, and she was also born with a congenital heart defect, which is bicuspid aortic valve.
Correct.
And also joining us with us today are Dr. Thukral, he's her cardiologist, and Dr. De Oliveria, and he is her heart surgeon. And we are so thankful for them joining us today. So I want to talk a little bit about not only heart disease, but how to prevent it. I want to talk a little bit about her congenital heart defect. And I also want to talk a little bit about what the importance is of raising awareness for heart disease. So let's go ahead and get into it. And first, let's go ahead and start with your story. So can you tell me a little bit about, you were born with this.
I was born with this.
And what was your journey like? How did this shape your life?
So I was probably, I say people born with congenital heart defects fall in two categories. Either they're discovered at birth, which mine was discovered within the first 24 hours, or others can live their entire life and not discover that they even have one until maybe something later in life begins to happen. I have friends who have heart issues and they discovered in their 40s and 50s that they were actually born with conditions and never knew. So I was lucky. I've known all my life that I've had the issue and have always had fabulous cardiologists in my life. I had a great pediatric cardiologist that followed me all during my younger years. The goal was always to live as much of your life as freely as possible with the best heart health possible so that you could do all the things you wanted to do, whether that was take ballet or play softball or have children. There really wasn't a concern that you couldn't live a full life with a birth defect. It was being aware of all the things you needed to make sure you were doing, eating right, being active, just being aware of listening to your own body. And so have made it almost a little over half of a century of my life before needing to take a look at something that was going wrong, and had a great cardiologist that guided through the process, picked out a fabulous surgeon, and we were able to do my heart surgery. Actually, November 5th was my heart surgery. So,
wow, and look at you.
So doing well,
You are doing well.
Yeah.
That's amazing. That's so amazing.
So yes.
And did you have any specific symptoms that we could talk to parents about, to look for?
So the way they discovered it upon birth was I had a very distinct heart murmur, a sound that was different from a normal heartbeat. And so they were able to diagnose it then. But one of the things that I will tell you as an adult, because my primary care physician, we have interesting conversations all the time, since she knows that I see a cardiologist. Normal primary care physicians don't do EKGs or really pay attention to those things until you're in your 50s. And really what you need are more baseline results for your heart earlier and earlier in your younger years. So if you're seeing a primary care physician and they don't regularly on your annual do an EKG, or they're listening to your heart, or even your child's pediatrician is not taking a look at that, you might want to ask, can you go ahead and run some baseline EKG just so we have that on file? I think those would be ways that people could discover sooner that they may have a condition than later. And really the sooner you can discover conditions, the better the treatment protocol always is.
I really like that advice. Thank you. I appreciate that. Dr. Thukral, can you tell us what bicuspid aortic valve is and how often, or how does it differ from other forms of aortic stenosis?
Sure. So the aortic valve is one of 4 valves inside of the heart that regulate the direction of blood flow. And it is the main gatekeeper that allows blood to leave the heart and enter the aorta, which is the main blood vessel of the entire body. And a normal aortic valve will open, allow the heart to eject blood into the aorta, and then from the aorta, blood is taken all over the body. And the valve will then close, allow the heart to refill, and then open again and allow that cycle to continue. And a normal aortic valve is what we call tricuspid, meaning it has 3 flaps. If you think of a circular pie and you cut that into 3 equal triangles, that is a normal tricuspid aortic valve. A bicuspid aortic valve has 2 cusps. So the morphology or the structure of that valve is clearly different from a normal tricuspid valve. And that structure being abnormal can lead to problems later in life. It predisposes individuals to perhaps have an infection on the heart valve. It can predispose them to having a leaky heart valve or a narrow heart valve much earlier in life as opposed to a normal valve. And it also can be associated with other congenital heart problems, particularly of the aorta itself. So these are all the things that we begin thinking about when we find a bicuspid aortic valve. We want to start looking at each of these things to make sure an individual doesn't have those problems.
Oh, okay. Well, thank you for telling us about that. How common is it?
The quoted incidence is about 1% of the population.
Okay.
So that number itself doesn't seem like a lot, but in medical terms, that tells us it's actually a pretty commonly encountered problem. So 1 in 100 people will have a bicuspid aortic valve.
Wow, that's so interesting. Dr. D, can you tell us what are the current treatment options for bicuspid aortic valve?
Well, I would say the important thing is really awareness. And so if a person has a bicuspid aortic valve, they should know they have because they need follow-up.
Right.
It's important to know that about, let's say, 50%, maybe even 2/3 of the patients are going to need some kind of procedure in their lifetime, either because the valve is going to develop a leakage or the valve is going to develop an obstruction or stenosis, like Dr. Thukral explained, or even, I believe, even more important than that, they have a tendency to develop a dilation of the aortic or aortic aneurysm. Amy had an aortic aneurysm that was 5 centimeters in diameter.
Wow.
When the aorta is dilated, there is a risk that that aorta can burst and dissect. And that is a major emergency in cardiac surgery, which many patients may not survive.
Right.
And so that's actually the main reason that I think is important to know if someone has a bicuspid aortic valve, because they have to be followed closely during their lifetime.
Right. Okay.
And then, of course, we have guidelines of the American Heart Association that guide us in how to treat these patients, and those guidelines need to be followed strictly.
Yeah. Okay. And what was it that you were experiencing that told you you had this aneurysm?
So going in for my annual, I was seeing my cardiologist every year, just for my cardiology checkup. I see my primary care as well. But discovered through my echocardiogram, which is an annual thing for me, that I had an aneurysm that was beginning to really bulge very near the valve. And that was the cause of concern that actually made us decide that it was time to do something about the valve and repair that aneurysm at the same time. In doing all the testing leading up to the surgery, we discovered I needed to bypass procedures. So we did it all on one day.
Yeah.
There you go. That's why we say I've had my 100,000-mile tune-up. I should never need to do this again, right?
That's awesome. What is the most important thing we should note about this particular congenital defect?
Well, there are patients out there that are completely asymptomatic and have an aneurysm that is large, and that aneurysm might burst and might dissect, and that person may die suddenly, and they don't even know they had a bicuspid valve or even a ruptured aneurysm. They may say, someone passed during sleep, and we don't even know what happened. Unless if you do an autopsy, you're never going to find out it was a dissection,
that's
the
what
rupture.
it was, right?
So I think the awareness is the most important, because like when Dr. Thukral said 1%, it sounds little, but that's 6.5 million in the country, or potentially.
And most of those are walking around and not knowing that they have this have a condition or have this condition because they've grown up through their childhood years and it wasn't discovered.
Yeah.
And then as an adult, they're not advocating with their primary care physician themselves on their heart health. And I think that's a thing too. People need to not just assume their primary care physician is monitoring heart health. They need to advocate for their heart health.
Yeah, absolutely. Yeah. Absolutely.
I remember once I operated an aortic dissection on a perfectly healthy firefighter, that had a burst when he was attending a fire.
Right.
Because he was under stress, he had
Under
a bicuspid
stress.
valve, and an aneurysm nobody knew about, and his aorta dissected. Fortunately, he arrived to the hospital alive, but how can you be more certain than that, right?
Yeah.
Right.
And he was, imagine, he was a firefighter.
Yeah. No, I know.
So-
You can be healthy and
you can
So
be
you-
healthy.
Right.
And you don't know. That's how aneurysms are, and that's why it's so important to know if you have one.
So, Dr. D, tell me a little bit about what you would say is the most important thing we need to know about this particular congenital defect.
The most important thing is to know that it's very common. Many patients are completely asymptomatic. Some others are going to have a sign that can be detected on physical exam by a primary care physician by taking a stethoscope and listening. They can listen to a murmur. They don't have to even have the experience of a cardiologist to describe what kind of a murmur it is, but that's going to trigger a cardiology consultation and an echo, and then the problem can be identified. And then those patients can be followed. And if they develop dilation of the aorta over their lifetime, we can monitor and we can operate before they become a surgical emergency.
Right.
With many patients potentially would not necessarily survive. And even for the ones that are lucky enough to arrive at the hospital when an emergency situation is happening, meaning an aortic rupture or dissection, the mortality rate of that operation is as high as 20% versus a 1% that in general would be for a patient like Amy is.
Okay, great. Good advice. Thank you so much. Let's switch gears a little bit and talk about general heart disease. Dr. Thukral, what are the most important steps individuals can take to reduce their risk of developing heart disease?
Yeah, I think that part of the recurring theme is awareness, right? And I think people need to be aware of their risk factors is really the primary thing.
Right.
The 5 traditional risk factors that we look at in individuals are a family history of heart disease early in their first-degree relatives, high blood pressure, high cholesterol, diabetes, and the use of tobacco products. And so it's important to get routine primary care because a lot of these problems can be detected by routine primary care checkups, routine blood testing, things like that. And while there's not a lot that you can do obviously about your family history or genetics, by managing the other 4 risk factors, you can help mitigate some of that risk. So if you smoke, obviously we want you to stop smoking and using any tobacco products. If you have hypertension, we want your primary care physician or your cardiologist or whoever it is to aggressively manage your blood pressure. We want to aggressively manage folks' blood sugar, their diabetes, and we want them to be managing their cholesterol levels appropriately, usually with medication and some lifestyle modification. And it's important, I think, not to downplay the role of lifestyle changes. A lot of these problems can be improved and sometimes cured altogether with alterations in lifestyle. So increasing physical activity, modifying their dietary choices. So a lot of things can help other than just medication.
That's good. That's great advice. So it's very significant, obviously, diet, exercise, and then family history does play a role.
Absolutely, absolutely.
Dr. Thukral, there are some people who are predisposed to these conditions, and then there are others that create those conditions with their lifestyle. So how would you say, how is it different in managing those two things?
So to some degree, I think there are a lot of similarities between those two groups, very clearly. And the overarching, I think, difference between the two is that when someone is clearly predisposed to a problem, they're born with a problem or there's a very strong familial predisposition to it, those people are probably at a little bit of an advantage. They know up front what the problem is, and they probably gear their lifestyle and their medical care towards mitigating that risk very early in life. Contrast that with someone who doesn't necessarily have this predisposition. They may not have that same motivation early in life to make better choices or more appropriate choices about their lifestyle and about seeking medical care, and about taking medications. But at the end of the day, I think both of those conditions, whether you're predisposed or you kind of acquire these things over your lifetime, require vigilance, they require regular medical care, and they clearly require a change to an optimal type of lifestyle.
And that's why awareness is so important, correct? I think we can all agree on that. Is raising awareness of heart disease is so important, and making sure that you advocate, as we were talking about before, you advocate for yourself with your doctors, and you say, hey, I'm having this weird, my heart seems to be skipping a beat. Even if it's just as simple as something feels off, can you please check me, or can you do a baseline EKG as you mentioned earlier?
And I think too, with the advent of digital watches, we're finding that a lot of folks that wear digital watches are catching AFib because their digital watches are catching the irregularities of their pulse and their heartbeats. And I think not ignoring things, and I'm going to speak as a woman, we tend to go, my kids are making me stressed. Right. Something's not really happening to me. I'm just a little under pressure. We need to start paying attention when our bodies are giving us signals. They're telling us something. And I think too many times we ignore those symptoms or those signals too long, and then we've created some problems for ourselves.
Yeah, absolutely. So, absolutely. Always pay attention to your body. Always pay attention to the signals it's giving you. And then mention that to your doctor.
Absolutely.
Don't be scared, to mention those things to your doctor. Amy, I'd love to dive in a little bit more to your personal experience and the profession that you've chosen, because you have chosen to work for the American Heart Association, which I think is awesome. We work very closely with them here at SWBC. So tell me a little bit about that and what kind of led you in that direction.
So obviously when you grow up with a heart condition, you are exposed to both the medical profession as well as the lifestyle piece of maintaining your health. I think for me, the AHA speaks to both. I think one of the things the American Heart Association does very, very well is continued research, a lot of resources that our cardiologists and physicians are using. In fact, I know when we had our first visit together, you were bringing up AHA research material. So that tells me that what the AHA does as far as research and sending out the most current quality data to our physicians, we get the best care possible. The second piece that the American Heart Association does really well is also look at those mitigating risk factors. Are we eating a good diet? Are we moving more? Because we're a pretty sedentary society. Are we getting good sleep? Are we drinking water? Are we managing stress? Or do we know our numbers for cholesterol, blood pressure, diabetes? And I think when we look at all of those factors, the American Heart Association here in San Antonio especially does a lot of local programming, not just for our clinicians and their patients, but also the community as a whole, whether it's coming in and doing hands-only CPR training to make sure our bystander rates are higher, or AED training because a lot of people are afraid to use the AED, right? Or even what simple things you can do in your normal daily lifestyle. I mean, we're seeing a lot more employers say, you need to get up and take the break and walk, right? You need to make sure that what you're putting in your body, no energy drinks, folks. I'm going to tell you that's bad for you. So, I mean, there's just things like that I think the American Heart Association does as far as community and general education, which they can all access on heart.org to get all sorts of information. But I think advocating for your medical care, making sure that you're doing the correct lifestyle, those are all things that appeal to me with the American Heart Association, and I think drew me to it as a career. But I see the impact it's made in my life as a patient, as a human being, and then what it has done for so many others, the research that's done, and all of that. So it's just one of my favorite things in life.
I spend a lot of time on their website because I serve all of our clients and their employees, and I want to make sure that they have access to resources. And AHA is one of the most amazing websites that you can go to and get recipes, and the recipes are amazing. And so I spend a lot of time on there taking those recipes and putting them into my newsletter and linking them to those resources because it's just an amazing website, and I love the American Heart Association. Would you say that there are any specific activities that you felt like you had to give up in your normal daily routine that you miss? Or are there things that you feel like some people may not know, I can still do this, I can still golf. You mentioned golf earlier.
I can still golf.
What have you had to modify, I guess is the right question. Have you had to modify
I don't think it's necessarily modifying, it's waiting until your body, in my case, recovered from surgery enough to go back. I mean, I still go to the gym, I still work out. We were laughing in the elevator that I'm now back to lifting weights. Not that I'm a bodybuilder by any means, but you know, it's getting back to the normal things. Right. I think sometimes when we get diagnosed with a heart condition or a heart concern, I think a lot of people think, oh, there went my life. I can't really enjoy the rest of my life. That's not the case.
Right.
It's just educating yourself and now being aware on a different level of what your health and your health care needs to look like. But I still do all the same things that I did before. It's just now I'm tuned up in a different way.
That's awesome. So how has your life changed since your surgery?
I am excited. I think having gone through this process and, you know, I want everybody to not need to have surgery. I know. I want everybody to not need to have surgery, but if you have to have surgery, to know then that on the other side of that, there's still life. Mm-hmm. I think it's just a mindset, and I think like everything in life, it's how you approach it. For me, I'm excited to be on this side of this journey and not waiting for it to potentially happen. So yeah, feels good.
That's good. Yeah. And the last thing, and it's definitely for me, I feel like the most important thing is support system. I see that you have a great support system here with your doctors. Can you tell me a little bit about family and friends and how important that is to your life and your recovery?
Absolutely. So clearly my primary care physician, my cardiologist, and now my surgeon, it was a team, right, of people that maintain my health. I think my mother, my friends that were all a part of making sure I was still eating or could drive to an appointment during my recovery, or even just encouraging words. And then just sometimes just being the person that said, you're gonna be fine and we're with you on this. I loved the people that came out of the woodwork that said, you don't know this about me, but I have a heart condition. And it opened conversations that they were scared to have. And so I think for me that being open and vulnerable and sharing about your health is just as powerful for the people around you, that they may then seek care that they need to have.
Agree, and that's why I wanted to do this series of on-demand videos, because I want people to be able to tell their stories so they can relate to our, you know, our clients and their employees. And then I love having the experts' opinions as well. So I really appreciate you guys joining us today and giving us this information. I think it's so vital to them, and we're just so honored to have you guys, and especially you being here, only having surgery a few months ago. There you go. It's just amazing to see how well you've recovered. It's a testament to your team of doctors. Absolutely. And again, we appreciate you guys. Thank you so much for joining us. If you guys have any questions for any of the team today, please feel free to email me at Staci, Staci.Loalbo, LOALBO @SWBC. I would be happy to connect you. And if you need any resources at all, please feel free to reach out. Thank you again for joining us on Wellness Now. Take care.